University President Shi Bingying from #1 Hospital of Xi'an University. They are members of the medical teams assisting Hubei, and they will answer questions from journalists. First, some update on the pandemic. In the 24 hours of May the 2nd, according to reports from provinces, cities, and Xinjiang Production and Construction Corp, new confirmed cases 2. One was imported case found in Shanghai. The other was a domestic case found in Shaanxi Province. There was no new death, no new probable case. On the day newly cured and discharged from hospitals, 28 close contacts that were removed from medical observation numbered 882. Severe cases were reduced by 3. And updates on the imported cases. Remaining confirmed cases of importation 451, including 6 severe cases. Remaining probable cases 9. Cumulatively confirmed imported cases 1,672. Cumulatively cured and discharged from hospitals 1,221. There was no death among imported cases. As of 24 o'clock May the 2nd, according to reports from provinces, cities, and Xinjiang Production Construction Corp, remaining confirmed cases 531, including 34 severe cases. Cumulatively cured and discharged from hospitals 77,713. Cumulative deaths 4,633. Cumulatively reported confirmed cases across the country 82,877. Remaining probable cases 10. Cumulatively traced close contacts numbered 734,281. Close contacts that remained under medical observation 7,539. According to reports from provinces, cities, and Xinjiang Production Construction Corp, new asymptomatic infections 12, including 2 imported asymptomatic infections. On the day, none of them were transferred to the category of confirmed cases. 33 were removed from medical observation, including 16 imported asymptomatic infections. Asymptomatic infections that remained under medical observation 968, including 98 imported asymptomatic infections. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 1,516, including 1,039 cases in the Hong Kong SAR, 45 in the Macau SAR, and 432 in the Taiwan region. On May the 2nd, remaining confirmed cases in the country have seen 11 consecutive day decline. New asymptomatic infections 12. That has been the lowest since we started the report. However, in 12 provinces recently, there has been the reporting of asymptomatic infections and new local cases. It reminded us that there is still the risk of resurgence. We must keep high alert as we resume business and operation. We must keep unrelenting focus on routine efforts of regular prevention control. Apart from the updates, on May the 1st, Dr. Tedros from WHO stated that COVID-19 remained a public health emergency of international concern, and he has taken the interim recommendations by the Emergency Committee. China appreciates and commends the work by the EC Committee. In our prevention control, will give full consideration to the interim recommendations. Will work along with all stakeholders to support the efforts of WHO and safeguard the global health security. In the past 3 days of May Day holiday, most of the tourist scenic spots have made arrangements in the staggering opening to well-managed visitor flows. We hope all the visitors and tourists will follow the orders, wear masks, have a good hand hygiene, go through temperature monitoring, and keep a good physical distancing. Now we'd like to take questions from journalists. Please ask questions on today's topic, and please identify yourself before you ask questions. The first question goes to the journalist on the second row on the right side. Thank you. With the CCTV. The medical team from a hospital affiliated to Jilin University had some innovation when they were in Wuhan. So what were your innovation and how did it help? I'd like to ask Vice President Li Guoyue to take the question. Thank you for your question. The ICU medical team arrived in Wuhan on February the 7th, and we stayed in Wuhan for 62 days. Most of us were in their 40s. 80% of us were young professionals in their 40s. They had audacity in the fight, and they have shown the ingenuity in the clinical treatment. We have been referring to our experiences in combining science research and clinical experiences, and we have applied their patents and the innovations to clinical treatment, thus ensuring the maximization of treatment efficacy and minimizing the possibility of infection of health workers. We had 4 innovations, and most of them were targeting at clinical problems. The first innovation I'd like to mention is a multifunctional face shield. When we were in the quarantined ward, so we had to wear the thick protective gear, masks, and face shields. One problem was that among those of us, it was highly difficult for us to communicate with each other. If we want to ask another by name, it was almost impossible. And when the doctors had the ward rounds, it was difficult to communicate. We have been wearing the protective gear for a long time, and we may have the insufficiency of oxygen. So most of us could not work prolonged hours in the quarantined wards. So we developed this multifunctional face shield, which I have put it up here in this. The headsets and the microphones have been added to the face shields, on top of which we put up a camera. More importantly, it has an oxygen supply unit and an oxygen generator, which can lead to a high concentration of oxygen, which can enhance the communication, deal with the oxygen deficiency, and also it has expanded the view of the health workers. Of course, there are still places for further improvement, and we are going through the second generation of product development. The second innovation was the swab, throat swab collector. We have a disposable throat swab. We know when we are collecting the swab, the patients tend to cough, and it may have a certain spray of droplets, which may lead to the infection risks. So we have, as on this picture, on top of the traditional throat swab, we put a shield which can cover the mouth and nose of the patients.
Then our medical staff can be protected from the droplet. So this is a very useful invention. The third invention of us is one-time preventing droplet tubes. And in the intubation process, we found in some of the process, the droplet will come out to infect the staff. So based on the previous intubation tube, we add some films and also add some 3 holes here. In this way, the staff and the patient can be isolated. The staff can be protected. So this droplet prevention intubation tube is very useful. The fourth invention of us is that in the isolated area, we found out that it's difficult for us to use the equipment to listen to the lungs of the patient. Because we need to know the oxygen level within the lungs. But in the isolated area, it's difficult for us to use this small gadget to listen to the lungs of the patient. So that's why we come up with a different gadget called stethoscope. In this way, we can hear the lungs of the patient within the isolated area. So this come out from original ideas of our hospital workers, and we come up with a product to be used in clinical treatment. In this way, we can cure the patient better while prevent the infection of the doctors. Thank you. Now we'll have further questions. The right side, the first row, the journalist on the aisle. Thank you. I'm from Cover News. My question goes to Professor Liang. I take note that Dr. Liang is one of the members, actually the head of the team to Italy. When you were there, Italy's situation was rather severe. What have you done in Italy? Can you introduce us your experience? Thank you. Thank you for your question. On March 10th in the morning, I got the notice from the government that I should go to Italy. On March 11th, in midnight at about 12 o'clock, when we got the visa from the Italian embassy in Shanghai, and then we fly to Rome. When we arrived there, Italian Prime Minister have already declared isolation and social distancing for 3 days. So when we wake up in the morning, the street was almost empty. There was scarce cars and people. So now Italian people are serious about social distancing. So we have done 3 things in Italy. The first issue is that we are involved in press conference, involved in communication with government officials and hospital managers. We communicate with hospitals, research institutes in Italy through lectures and communications. We told them about our prevention measures and our experience in COVID-19 fight. And together with research institutions in Italy, we discuss with them our successful practice, including our usage of some drugs. And through this kind of communication, we told them we also use tocilizumab. And through this kind of communication and through seminars, and we brief them about how can we prevent COVID-19. And we also lecture with overseas Chinese, overseas students in Italy, and brief them about prevention knowledge. And there were about 300,000 overseas Chinese in Italy, and our communication helped to stabilize their mood. We also work together with the Red Cross of Italy. We were deeply impressed in this trip by the advanced medical professionalism of Italy, which is the region of modern medicine. And all the doctors and nurses in Italy are working very hard. They are working diligently and carefully to provide care to the patient. We should learn from Italy hospital workers as well. Once we walk along the street of Italy, we see some Italian people raise their thumb to us, showing their praise to us. And an Italian girl even draw a cartoon with Chinese and Italian raising up the girls together. Through such a visit, we have communicated on how can we fight against COVID-19. COVID-19 is the common enemy of human being. We believe that through the joint efforts of domestic and overseas doctors and nurses, through concerted efforts, we can win the war against COVID-19. Thank you. Now we allow further questions. On the left side, the first row, the second journalist. Thank you. From Economic Daily, we take note that Hubei municipal government declare that the A-level sanitary spot will be open for free to all doctors and nurses. And so I want to know for the medical teams to Hubei, what do you want to say about this? Now the floor is given to Mr. Fei. Thank you for your question, and thank you for your interest in medical teams to Wuhan and Hubei. As mentioned by President Xi Jinping, this fight is a fight for all human beings, for all people, and this victory reflects the advantage of our system. And this reflects we focus on human being. We are working at the front line, and we are the witness of the efforts of all people around the society. In this fight against COVID-19, doctors and nurses in Wuhan have went in harm's way, and they are real heroes. Every morning, on the way to the hospitals, we see many volunteers, and they are providing transportation to the doctors and the nurses, and they are trying to transporting the materials. And also we are seeing cleaners cleaning the street. We are seeing courier people sending courier passage to thousands of families. And we also saw many policemen and many community workers at the community gate. And also we were living in hospitals. We are living in a hotel near the hospital, and the hotel workers and the managers provide us hot and warm food because they have warmers for the food. And also, we have Chinese jiaozi and Shandong's steamed bread and vegetables from across the country. In this way, we can eat better and increase our health as well. And there are a lot of materials donated to us. We share these materials with all the other medical teams, and the other medical teams also share their donated foods with us, and we can share the apples from Xinjiang, and also we can get different local food from other provinces. And 2 truck drivers from Shandong drive overnight to Wuhan, and the cargo owner gave them some money, but they use this money to buy mineral water and bring this mineral water to our hotel. All of this is a great encouragement to us, and the donation from the different sides of the society give us a great impression. Thank you. That's all. Now we allow further questions. On the left side, the second row, the first journalist in black.
With the CNR, I have a question for President Xi. We know the medical teams have been focusing on increasing treatment rate and reducing the fatality rate. What were the innovative tries by your hospital and by your team? Thank you for your question. Prior to our travel to Wuhan, I have been pondering over the question of fatality rate reduction. After I arrived in Wuhan, I brought with me some medicines. Hypothetically, it might be a very severe situation, and I want that my personal drugs can come in help. I worked in the eastern wing of the hospital. After some of the efforts made, we found the fatality rate was high. I was suffering from great anxiety, so we set up a team on the research and the study on how to reduce the fatality rate. I remember Professor Yue, Professor Long from West China Hospital and other hospitals became team members of this special study group. Whenever there was a death case, we looked further into the reasons. We dug very deep into the reasons behind the fatality rate. I remember once we had 315 WeChat messages back and forth to discuss one death rate. And with the in-depth study, we provided feedback to the team members, and I will report our findings and analysis to the team members on our regular meetings. And we made improvements accordingly, and several days later, we found a substantial drop in the fatality rate, and soon we saw the zero fatality rate. That was a very gratifying result. On a daily basis, I have put all the information into an Excel sheet. Whenever I have time, I make in-depth analysis, and I report my findings to all the team members. I think this consultation and in-depth analysis is important in reducing the fatality rate. Thank you. Next question, please. Journalist from the third row on the left side, please. With the Phoenix TV, we know in the early days, many medical teams were faced with the difficulty of medical supply shortage and PPE shortage, and many medical teams received support from their home hospitals. I want to ask, how did you face with such shortage difficulties in the early days? I'd like to ask Vice President Liu Geyue to take the question. Thank you for your question. Our medical team from Jilin University arrived in Wuhan in early February. Back then, all medical teams were faced with the same difficulty of the shortage of equipment for the treatment of acute severe cases. We were helping Tongji Hospital, which was a major hospital, but because many patients swarmed into the hospital, so many test results may come back very late, which exert negative impact on the treatment of the patients. In such context, on February the 11th, or the third day of our arrival, we contacted our home hospital and asked them to transport the portable testing equipment, including bedside ultrasonic, blood analyzers, and coagulation testers, or other medical gadgets along the bedside. So 2 medical ambulances spent 2 days and nights to transport all these portable bedside equipment from Changchun to Wuhan, meeting the needs for faster testing. And later, to enhance the treatment of critical cases, we contacted our home hospital, and our home hospital contacted the manufacturers in Shanghai. So respirators, 1 ECMO, and 2 blood purifiers were transported from our home hospital or from the manufacturer directly to Wuhan. These are essential medical equipment needed for the treatment of severe or critical cases, and these equipments came in handy help. Meanwhile, we asked the sending of 4 extra health workers, ultrasonic, anesthesia, and cardiac experts to facilitate the intubation, the use of blood purifiers, and the use of other severe case interventions. That's why we asked 4 additional experts, medical professionals. Because the wards were renovated into ICU, if the health workers were working in these quarantine wards, they couldn't see the monitors. We know there has been rapid progress of the disease, so we couldn't afford a blind zone between the working zone and the quarantine zone. So we asked the home hospital to send us the video systems. And these video systems were distributed in the health quarantined areas and our workplaces to facilitate the physicians checking of the progress of the physicians on the fingertips of their mobile phones. And all these equipment and the deployment have enhanced the efficiency and efficacy of the treatment. And several days later, another ECMO was transported from our home hospital in Changchun to Wuhan, and it was immediately put into use. So in the 2 months that we worked in Wuhan, our home hospital has sent us 4 batches of much needed equipment in a timely manner. Our treatment equipment, testing devices, and health workers were then sufficient, providing a solid support to our successful treatment. Thank you. Next question, please. Journalist from the 3rd row on the right side, please. Thank you. With the Red Star News. We know that in the relief of Wenchuan earthquake, West China Hospital of Sichuan University has been an active reliever. Compared with the traditional major disaster relief, what has been the new impressions from this Wuhan assistance? I'd like to ask Director Liang Zong to take the question. I'd like to thank the journalist from Red Star News for your question. Back in 2003, I participated in the SARS combat. I remember journalists were asking me, that was a severe disease. Are you afraid? I said, it is pneumonia. I am a physician from the respiratory department. It is incumbent on me to go. For all of us as health workers, we have the same choice. Sichuan experienced several earthquakes in Wenchuan, Lushan, Jiuzhaigou, and Yibin, and there had been some major public disasters, and thereafter public health interventions must be in place to provide relief. Being it SARS or COVID-19, they have both been critical battles given the so many unknowns and uncertainties. We set up China International Emergency Medical Team. It is the 15th EMT established and recognized by WHO. It is the highest level of EMT of non-military nature. It is also the second EMT Type 3 international medical team for emergency relief. We have 66 core members covering all the secondary disciplines. Within 2 hours, it can form into its formation without any external support. Our EMT can function on itself to provide medical relief for 28 days.
After COVID-19 pandemic happens, and we arrive at Wuhan on the earliest call, and during the treatment process, medical staff from different disciplines worked on the ventilator management and respiratory tract management, and also respiratory system recovery. All of them have played a professional role to increase the respiratory support to the patient, and the clinical result was very good. As compared to the previous major health event, this current rescue are equipped with more advanced equipment, with better PPE, and we have a better EMT and NMDT team. However, faced with such a deadly virus as COVID-19, at the very beginning, we don't have a full understanding about COVID-19, so we have to do a lot of research. Faced with life and death, we have to be prepared, and we shall not relax ourselves and feel complacent. Now, we'll have further questions on the right side, the third row, the first journalist in black. Thank you. From China Radio National. We understand that for COVID patient in treatment and isolation process, their relatives cannot see them, cannot visit them. Can you explain us the reasons why their family members are not with them? They may need more psychological care. So what have been done by the medical team? Now the floor is given to Shi Bingyi. Thank you. Thank you for your question. As you may know, COVID-19 is a kind of a strongly infectious disease. So without proper protection, infection will increase. So if relatives are not equipped with medical knowledge, even if they wear PPE, they may be infected by their relatives. That's why we don't allow relatives to visit the patient so as to reduce infection. In our hospital and also for medical teams in Hubei, we are trying to improve the conditions to enable the patient to have contact with their relatives through internet. In our wards, there is a professor from Wuhan University who is in a severe situation. His spouse is also suffering from COVID-19, living in mobile hospital because her case is mild. But his spouse is worrying about the professor. That's why we arrange them to live in the same hospital walls. And then his spouse will visit her husband several times in a day. And although they live in the same walls, but they cannot see each other, cannot touch each other. And so when the older lady pressed the bell, and actually the older lady is only asking whether her husband have eaten something, have changed the position. After several days, she is less worried. And then our nurse goes to the older lady, why you don't press the bell anymore? And then his spouse said that Mr. Huang sent a message to her because Mr. Huang is well cared about by the nurses. So the lady don't need to worry about her husband. So through this kind of human care, we can enable our patient to recover both physically and psychologically. Within our medical team, during the treatment process, we also consider that the patient may need contact with their relatives. So that's why we set up a WeChat group for patient, relatives, and doctors within the same group. In this way, the relatives can understand the changes of the medical condition of the patient, and we can have a smooth communication. There was one patient who have a great fear about this virus. That's why our nurses and doctors explained to him, and he is not satisfied. That's why we got in a psychological doctor into the WeChat group. After several rounds of communication, he feel better. And after he was discharged, before he left the hospital, we met him. So this patient take a video of our passage and send this video in the WeChat group. He said, "Goodbye, dear doctors. I don't want to say goodbye." So he's deeply impressed by our care for him. And when he was in home, he planted 2 trees. One of the tree, he gave the one of the tree as hard work, while he named the other tree as precious people help them, because we and Guizhou together provide services to them. That's why he called this tree as a Gui tree. It means that precious people provide support to him. So psychological and human care are very important for the treatment of a patient. When I was managing the hospital in everyday life, we pay attention to psychological care. In Wuhan, we also pay attention to human care. So I feel satisfied with my nurses and doctors within our hospital. There was a report which can reflect my feeling. That is, when we come back to Chang'an, we live our love in Chang'an and in Wuhan. Thank you. Now, the left side, the second row, the journalist on the aisle. Thank you. I'm from Economic Herald of Hong Kong. My question goes to Shandong and Sichuan, 2 hospitals. When you arrived at Wuhan, you met West China Hospital staff, and you cheer each other and met each other. On April 15th, Qilu Hospital and West China Hospital say goodbye to each other, and now the 2 hospitals are gathered together on this stage. Do you want to say something to each other? So the 2 hospitals are working together, hand in hand, in the cure of severe disease. What kind of cooperation can you share with us? Thank you. I first give the floor to Mr. Fei Jianchun. This is a good question, and this video is very hot on the internet. When we arrived at Wuhan, that is on February 7th, when we say goodbye to the captain of the airport, the captain told me that there were 3 airports landed in Wuhan that day. So there is another airplane getting the doctors from West China Hospital to Wuhan. So we arrive at the same time. We have the same goal, that is to support Wuhan and fight against COVID-19. As you may know, that we met each other in Wuhan in Tianhe Airport 87 years ago during the fight against Japanese. West China Hospital and Qilu Hospital met in Wuhan and try to set a hospital to cure those warriors who suffer, who get pains because of the anti-Japanese war. And it is lucky that the 2 hospital team work in the same hospital in Wuhan, and we work on the same floor, responsible for different wards. And Qilu Hospital often invite us to help them to diagnose a patient, and we often have online discussion of patient cases. Because our team focuses on respiratory disease, while West China Hospital focuses on ICU. So we learn from each other and improve our treatment of the patient. We have make friends with each other, and on April 15th, the 2 teams took a photo together, and we signed the slogan, that is Qilu Hospital and West China Hospital are together. And I think our friendship can weather the times, and in future West China Hospital and Qilu Hospital may have more communication, and we can work together for the medical profession of the country and make contribution to people's health. Thank you.
Thank you. Last question for the day. Journalist from the 4th row on the right side, please. Thank you. With the 健康报 JKB, shortly before there were reports saying that some COVID-19 patients in Wuhan for a long time showed positive NAT test results. Did you meet such situations? What are the differentiated treatment for such patients? Thank you. I'd like to ask Director Liang Zhong'an to take the question. I'd like to thank JKB for this great question. It is also a question of profound concern by the journalists. Most of the patients with the long-term negative positive NAT results have been tested with antibodies, and we haven't seen the infection caused by these patients. We need to pay attention to the following things. First, we cannot exclude the possibility of infection or transmissibility of such patients, but even as a transmission source, their transmissibility is very low. We need to further press studies on this front. COVID-19 has been with us for only several months. We need to look further into its pathogenesis and transmissibility. For the most of the patients with long-term NAT positive test results, as we have been monitoring these patients, most of them have seen positive to negative transformation. For those who remained positive are kept under quarantine and observation. You've also asked whether there is treatment needs. Most of such patients do not show symptoms, and if they do not carry underlying diseases, they don't need special treatment. But given the fact that their NAT test result remains positive, we still put them under quarantine and under medical observation. Thank you for your question. I'd like to thank the guest speakers for reliving and sharing their experiences with us. Again, I salute all of them. Tomorrow we will have health workers from Zhongnan University affiliated Xiangya Hospital and Sun Yat-sen Hospital, and also the transportation team, the ambulance team from Henan Hospital, to take questions from the journalists. We look forward to your continuous attention. We conclude today's press conference. Thank you.